Dr. Archana. That time she can start. Shall I start or should I wait for some time? Shall I start?
Yes, madam.
Shall I start?
Yeah, go ahead.
Yes, ma'am.
Yes.
You can start.
Okay. Right. Yeah. Good afternoon to all of you. I would like to welcome you all to a webinar on the need of Swachhata during COVID-19 pandemic period by Dr. J. Archana, MD, Assistant Professor, Gandhi Medical College, Hyderabad. This is part of the activities associated with the Swachhata Pakwada, which is being celebrated during the first fortnight of July every year by all ministries and departments of the Government of India. In connection with the Swachhata Pakwada, I would like to reiterate the importance of the cleanliness of environment in the overall health of individuals or society apart from the personal cleanliness. This has been highlighted by doctors, health workers, and other medical professionals during the COVID-19 pandemic. In addition, they have been putting their and their families' lives to risk to save the lives of others, especially those affected by COVID-19. So, it is our duty as responsible citizens of this country to stay indoors and follow the valuable instructions given by the medical professionals to keep ourselves and our families away from COVID-19. Dr. J. Archana is currently working as assistant professor in Gandhi Medical College, Hyderabad. She had done her MBBS at Osmania Medical College and MD at Gandhi Medical College. She has 11 plus years of experience as general physician and has received many appreciations for her efforts. In recognition to the services rendered by her, she has been given a special appreciation award at MN Area Hospital, Malakpet. Hence, I would like to invite Dr. experiences regarding the observance of cleanliness in the current pandemic situation. Now I request Dr. Archana to take over. Ma'am, please.
Very good afternoon to all. My topic is Swachhata during COVID-19 pandemic. So as we know, COVID-19 is a very deadly virus. How it has impacted our daily activities. For the last 1 year, it has damaged a lot of things. It has caused a lot of mortality. Almost 4 million deaths have reported in the last year. So as I'm working at Gandhi Hospital, I have seen many deaths due to this COVID-19 disease. Most of the, not only the old people, even the younger people have died because of this COVID-19 disease. Basically, what is COVID-19? I want to explain first the title of the topic. So first, we need to know Swachhata. What is Swachhata? Swachhata, we know in English, it's cleanliness or neatness or sanitation. So COVID-19 is a novel coronavirus. It's a viral infection. It occurs, it spreads from person to person. So if we have to stop the spread from person to person so that you can stop the disease, how can we stop the spread of person to person is by cleanliness. As we all know, prevention is the better than cure. After after the occurrence of disease, treating, in spite of that, if you prevent before it has spreaded. So cleanliness or Swachhata plays a major role in preventing the COVID-19 from person to person so that the pandemic will get reduced. So what are all the key points in Swachhata? As we know, from the last year, we are looking, three main things are mainly important. That is masking ourselves, one point. Next, using a hand sanitization and disposal of the waste. So these are the three main things I am going to discuss in this topic. So first is masking. You have to use a mask properly. Proper masking is important. Most of the people use a mask, but they won't fit on the face properly. Like they keep it under the mouth, or they keep it over ears. I have so improper mask is not at all useful. It cannot prevent the infection. As we know, um, first most and at most important thing in prevention of or prevention of infection spread is mask. So how to use the mask is both the persons has to use the mask. If one person has used the mask and another person not used, it is not of helpful. It also causes infectious spread. So as we know, COVID-19 spreads by the respiratory droplets, one thing. So when a person with COVID-19 infected will speak, when he speaks also, the some of the respiratory droplets will come out of his mouth, and those things will cause spread of infection, not only during the sneezing or coughing. Even when the person speaks, also the respiratory droplets will come out, and it cause infectious spread. And when he speaks out, those respiratory droplets fall on the surfaces. If we touch those surfaces and touch our nose and mouth, and that is also one of the mode of spread of infection. So masking is in that way important, because not only during the coughing and sneezing, it is important to mask ourselves even during the while we talk. So both persons using the mask is more important rather than one person wearing a mask and another one not. So first one is masking. Next comes is the transmission also occur by touching the contaminated surfaces. So hand washing is the second most important thing in stopping the prevention of COVID-19, stopping the spread of COVID-19. So we have to wash our hands. When you should wash our hands is important. Whenever you touch most frequently touched surfaces like door handles, remotes, switchboards, like those things. Whenever you deal with the food items before and after preparing the food, whenever you go to the toilet and come out, and whenever you go out and come to the house, all those periods you have to wash your hands. And whenever you're dealing with the sick person who is infected with the COVID-19, and the person who is handling with the uh, animal products, animal wastage, also should wash their hands frequently. So hand washing is not only simply washing your hands is not enough. You have to use scientific method. I think 3-4 slides below the carbon picture hands. Can you show Ganesh hand picture? Slide number 10. Ganesh, can you share slide number 10? Hello.
Kiran, who is handling PPT?
Share the slide 10. Okay, the picture is showing that when you are washing hands, simply there are 4 methods. He has shown 4 different methods how we usually practice hand washing. Before hand washing, there is a picture showing lot of microorganisms on the hand. The second picture showing that if we place our hand in a water, simple rinsing causes some amount of reduction in the microorganisms, but there are a lot of presence of microorganisms are there in this picture. If you wash it for 6 seconds, also not completely reduces the microorganisms. If you wash it 6 seconds with soap, also cause some of the microorganisms to remain over the hand. 15 seconds also has caused some of the microorganisms to remain that over the knuckles and over the nails. So complete removal of organisms occurs only when you wash your hands with soap for 30 seconds. So hand hygiene is very critical in this COVID-19 period in reducing the risk of COVID-19 spreading. It is more effective. Not only the COVID-19, most of the healthcare most of the diseases, most of the infectious diseases can be prevented by proper hand washing. So hand washing must be regular, frequent, and it should be the integral part of our daily routine. So now the slide has been shared. As I have told before, the first slide containing first picture containing most of the organisms over the hands. When you rinse it in the water, it has reduced only some of the microorganisms. And when you rinse it for 6 seconds, it has reduced some more, but not complete removal of microorganisms. Only when you wash your hands with soap for 30 seconds only will reduce complete loss of microorganisms as shown in the picture number 6. Okay. So hand washing, there is a scientific method recommended by the WHO, which we have to follow for hand washing. There are 6 steps. First, you have to, as shown in the picture, I think it is there in the slide number 14. Ganesh, shares slide number 14. Yeah. As it is shown, first you have to wash your hands with the water. Then take adequate amount of the soap. Then wash your hands, wash your palms, rub your palms. Each step for 5 seconds. Remember that. This wash first palms. Next, dorsum of the hands, both the dorsum of the hands for 5 seconds. Next, interlace the fingers. Next, clean the tips of the fingers with other hand, rubbing over the palm, both the hands. Next, you have to clean the thumbs for 5 seconds, both the thumbs. Next, you have to clean wrist and up to elbow. This is the standard procedure. Each step for 5 seconds. Overall, 30 seconds you need to wash your hand and keep it under the water. Completely rinse with the water. Then dry it under the fan. It is the scientific method of WHO to follow so that we can prevent maximum amount of the virus, so that we can wash out maximum amount of the virus. So when you should wash your hands? After coughing and after sneezing, as you know, whenever you're caring for the sick, before and during and after you prepare food, before eating, after toilet use, and whenever you are handling with the animal products. I think 16th slide you should. 16th slide. Share the 16th slide. As it has shown, wash your hands regularly with soap and water. Use a scientific method. Whenever you sneeze or cough, better you use you cover your mouth and the nose as well. Stay away from the people who are sick or who have flu symptoms. And if you get the symptoms, better you visit a doctor as soon as possible. So this pandemic has proved the importance or shown the importance of basic sanitization methods, how much they are important, so that we can prevent these infections. So you should also know, whenever you clean the surfaces, whenever you use some products, and disposal of those things used by the COVID-19 patients, or household waste disposal is also important in preventing the infectious spread. So now we have done with the face masking and we have done with the hand washing. Now I am going with the cleaning of surfaces. Okay, regular cleaning plays a vital role in preventing the transmission of the disease. Okay, so how to clean the surfaces? As we know, we mostly use detergents, soap, water. So depending on the area which you are using, you have to use the products. When a surface is infected with it's soiled with any organic material like uh, patient secretions or a blood, it should first wash through detergent water or soap water. Afterwards you can use a disinfectant like bleach or alcohol based products. You can directly use bleach, but these organic matter like blood will reduce the effectivity of the efficiency of those bleaching powder. It needs more contact time and more concentration of those disinfectants to kill those microorganisms. So if you clean it with detergents or soap water, first this organic matter will get cleaned off, then you can use this bleaching powder or alcohol based products. Standardly we use sodium hypochlorite solution or alcohol based products. So what the disinfectants must be used is sodium hypochlorite 1%, 0.1% will prevent the COVID virus. And if alcohol used, it should be 60 to 70% of alcohol should be there, which will maximum kill the COVID-19 viruses. So whenever you're using the disinfectant, the contact time, how much dilution has to be used and how much contact time should be there, all should be keep in mind so that complete cleaning of the surfaces will be done. Okay. So what are the things should be cleaned? That should be keep in the mind. Like when a person talks or sneezes or coughs, the droplets will spread over the surfaces, floors, tables, chairs, and all those things. So all the things has to be cleaned. Most frequently touched surfaces like door handles, electrical switches, remote controls, all those things has to be cleaned frequently because those are frequently touched surfaces. And a person who is caring with the COVID-19 patients should wear a PPE, and that PPE also disposed properly. And these cleaning methods will be usually done by the sanitization workers should be more precautious to prevent infection to them, spread of infection or acquiring infection. They should be cared more and they should be more precautious. Okay, so apart from the surfaces, door handles, the toilet has to be cleaned. The COVID-19 patient should use the separate toilets and the toilets has to be cleaned regularly. And the common kitchens, if you use, those things also cleaned regularly. Normal normal offices are a regular places where people usually visit more. The more the people visit, more frequent washing is more important. they should be provided, and the public places where the people visit our offices should be provided by the hand sanitization uh, and hand sanitization methods and toilets. So what are all the disinfectants should we use? We normally use bleaching powder uh, or detergent and soap water. Whatever the concentration mentioned in the particular bottle, you should follow those. Usually 0.1% or 1000 ppm bleaching powder we use usually. If it is infected with the 5%, infected with the organic material such as blood or secretions of the patients, then you should clean it with 5% of 0.5% of the bleaching powder. But it is more hazardous to the people who are dealing with those solutions because it causes skin irritation, eye irritation, and bronchospasm, especially in asthmatic patients. So, keeping in the mind, better use lesser concentration of bleaching powder and better you use a soap water or a detergent before using the bleaching powder. And you should keep in mind that don't use or don't mix two detergents, two disinfectants, don't mix because it may cause hazardous production of hazardous products or fumes which may be harmful to the person who is dealing or to the environment. Better avoid mixing those things. So whenever you are dealing with the wastage of COVID-19 people, or whenever you removing the PPE kit after entering, after dealing with the COVID-19 patients, better you wrap that PPE kit into one plastic bag and keep that plastic bag into another bag and keep it away from the other waste, regular waste. The waste should be keep away from the regular waste. Better you keep it for 72 hours so that whatever the virus is there in the that cover will die after 72 hours. Then you can dispose it off with other waste, or else you can dispose it separately. So why these things has to be cleaned? As some of the studies state that uh, reported that COVID-19 virus stays over the surfaces for different time periods, usually 1 day over cloths and 3 to 4 days over plastic and 7 days over stainless steels and all. So that is the reason we have to clean all the surfaces and all the products so that we can prevent the spread of COVID-19. So the right product which has to be used should also be kept in mind. Usually we use 0.1% bleaching powder or 70 to 60 to 70% of ethanol or hydrogen peroxide and soap water or detergent. As COVID-19 is a enveloped virus, so which product is effective against the enveloped virus should be kept in mind and you should clean with those products. So which products you are using? As I have told previously, bleaching powder and alcohol and soap water. This bleaching powder with higher concentration, if we diluted very less or very low concentration, it's not going to be effective. So you should properly mix or properly dilute those things. While diluting, take proper precautions like using the mask or using the eyeglasses so that it won't cause eye irritation or skin irritation. And some of the patient may get bronchospasm, as I told before. It produces the fumes which are hazardous to the asthmatic patients. It may cause bronchospasm and shortness of breath in those patients. This cleaning here shows the importance of cleaning ourselves and cleaning hands, cleaning surfaces, and masking. These three things plays a major role in preventing the spread of COVID-19 infection, so that we can prevent person to person spread, and we can reduce the morbidity and mortality related with the COVID-19 infection. These disinfectant procedures not only reduce the COVID-19 viral infection, but also the other viral infections, rotaviral infections, other flu-like infections, all foodborne, waterborne infections also can be prevented by these sanitization methods. Thank you. That's all about my topic.
Yeah. Thank you, madam.
Yeah, thank you very much, Dr. Archana, for the enlightening talk. There are a few questions. Shall I read out the questions? You can answer, actually. 1 second, I'm reading.
Yes, ma'am.
Yeah, TBS Sudebhaskar, he has asked, what are the side effects of excessive hand wash, particularly the use of sanitizer in long run to the skin?
Yeah, it causes dryness, peeling of the skin. So that's better you use moisturizers after washing the hands, and excessive concentration of the soap or excessive concentrated sanitizers also cause skin irritation, dryness, and peeling of all the skin, and it may cause itching. If more itching is there, it may cause secondary bacterial infections.
Yeah. Actually, I have two queries. Like, is it safe to eat out from hotels? Like, what happens if the food we take is having coronavirus?
Yeah. Actually, the well-cooked virus won't cause infection spread, because as we cook in the heat, that virus will get damaged. But the person dealing with those foods or the material we use to preserve those food will cause infection spread. So if you get the food from outside, better you heat it, better you take out those material, whatever is stored with proper precautions will prevent the infection. You can eat hotel food, but with proper precautions.
Okay, and one more question I have is, suppose one person got both the vaccination, like both the doses of vaccination. So can I be a carrier? Like, can that person be a carrier?
Yeah, he can be carrier. There is nothing like that he won't get infected or he can't be a carrier. He can be a carrier.
Okay.
The vaccine prevents yourself, reduces the getting infection, but it does not prevent the spread of the infection.
Okay. Okay, and now I think that's all the queries I'm seeing in the chat box. So thank you very much for answering our queries. It is very beneficial for the inquest community as well as other viewers watching this live stream on YouTube. I'm sure that this will be a great contribution towards the Swachh Bharat during this pandemic situation. Now, I hand it over to Mr. Mahendra to propose the vote of thanks.
Sandhya, can you hear?
Yeah.
I have two doubts.
Okay.
Yeah, madam. It was a nice presentation. And my one query is actually how frequent we are supposed to take the set of vaccines. Like, if the 2 doses are over, how frequent I am supposed to take in coming years if the virus is up here?
As of now, the proposed doses is only 2.
Okay.
There are studies going on third dose, not yet confirmed, sir.
Okay.
As of now, only 2 doses, and depending on the vaccine you used, actually, as we are getting Covaxin and Covishield, those are only of 2 doses as of now. Proposed doses are only 2.
Okay. One more last question. whether I can mix the vaccines, like the next set of vaccine I can take after 9 months or 1 year, another one, and the third
Yeah,
one.
there are studies going on that mixing up of vaccines will cause more efficiency, but not yet confirmed, sir, and not yet released.
Okay, thank you, Sandeep.
Yeah, a few more queries have come. What is the third wave impact on the children, and how to protect our children from the third wave?
Yeah, I don't know. Actually, third wave is causing children are more affected. The studies are proposed like that, but I don't think it will cause. Yeah, one of the reason why childs get affected is they are not vaccinated. Most of the adults are got vaccinated, but child till now they are not started, so they may get affected. So how to prevent the infection is as usual, whatever the methods we use to prevent infection, the same things has to be followed: masking, social distancing, hand washing, and all those things. Keep the children, don't allow the children to go outside. um, Eat healthy food, don't eat stored foods, all those things. Use clean water. Whatever you use, wash it and use.
So that is the end of the queries. Thank you very much for answering our queries, and I request my colleague Mr. Mahendra to propose the vote of thanks.
Yeah, thank you very much, madam, for. So we all know that the famous Sanskrit proverb, Vaidyo Narayana Hari. So you have a major role in treating us and we are being healthy, and we are evident this from the recent current pandemic, and you all stood in the frontline warriors and you saved millions of lives across the world, and thanks to the doctors and your families, we stood with us. So as part of INCA's Swachhatha Pakwada 2021, so INCA is requested Dr. Archana, MD Assistant Professor, Gandhi Medical College, Hyderabad, to deliver talk on a topic, need for Swachhatha during COVID pandemic period. So in spite of your busy schedules, you have happily accepted our invitation and made it successful. Thank you, madam. So on behalf of INCAS and Swachhatha Committee, I would like to take this opportunity to record our heartfelt thanks to you for delivering informative and enriching talk. Madam, we are happy, we are very much enlightened and privileged to have you on this occasion, and you are enlightened us, all of us, on the importance of cleanliness and medically approved practices to protect us from the COVID. So once again, thank you, and I also thank Director, Swachhatha Committee, Administration, and all others who helped in successful conduction of this event. So with this, I will conclude this meeting and close this event.
I want to. Yeah. I want to say two things.
Yeah, please, madam.
Yeah. Thank you, INCOIS, for giving me the opportunity. Thank you, one and all. Thanks a lot.
Thank you, madam. Hope we all will associate in future and we'll meet you again. Thank you.